Okay. Announcements. Your assignment 1 is due tomorrow night on eCampus, and make sure you submit the Word documents only. That's how we can grade it. Yes, Marcus?
How do you look at it? You said like if we want to like go back and revise it, if we turn it in early, like how do we see like what comments you left on it?
Oh, I didn't leave comments. I didn't grade them. Emily will be grading them, but making revision is just that if you didn't have enough time to work on it, you submit like a rough draft. Now you have the time to work on it. And make sure you send me the email today. Tomorrow I'll have a ton of meetings. I might not check emails very frequently. So if you need to make revisions, let me know by today. And I will make sure you can resubmit it on eCampus. Okay. Your exam 1 is on Friday. Again, don't cheat. All the troubles that you'll get is embedded in this link. If you're interested, go take a look, and you can weigh the risk and benefit. It's definitely not worth it, so don't do it. So some of the stuff that includes in the website, it tells you like you go to Honor Console, you might fail the class, suspension, it might affect your future scholarship and job. It's just not worth it. Just try to see what you really learned or didn't, and then you can see what the problem is, and we can solve that. Okay, today we'll finish chapter 5, talk about sleep, hypnosis, and some drugs. So we're gonna continue sleep disorders. Narcolepsy, that's when people go from waking state to REM sleep abruptly. They don't go through N1, N2, N3, they go straight from waking to REM. Oh, that's wrong. Okay, so cataplexy, that's the symptom, which is when you collapse, when the switch occurs, waking to REM sleep. You also have muscle paralysis in REM sleep, if you remember. So the cause for narcolepsy is the lack of neurotransmitter, which is called orexin. This regulates arousal, wakefulness, and your appetite. So this can be very inconvenient and dangerous for the patient. I don't know if you've seen videos on YouTube, they show what it looks like for people who has narcolepsy. It looks hilarious, it looks so funny, but it's so dangerous for them. So yeah, if people do have that, don't laugh at it. It's very hard for them. Okay, so this is a video with a dog who has narcolepsy.
Skeeter is a small dog with a very big problem. No matter how much he struggles to...
Wait, I forgot to share the audio with online students, so give me 1 second.
Stay awake, he can't. For this 11-pound toy poodle, almost every moment is a disturbing, losing battle with the urge to sleep. There he goes, out cold. Skeeter has narcolepsy, an uncontrollable urge to sleep. Skeeter's struggles to stay awake are heartbreaking for his family, the Hendersons of Chubbuck, Idaho. His narcolepsy is triggered by excitement, so he can be out for an afternoon walk and just fall asleep sitting up.
There you go. Come on. You can do it.
The tail-wagging prospect of jumping up on Shari Henderson's lap suddenly sets Skeeter snoozing.
Come on. Oh. He's miserable. He looked like he was a prisoner in his body. He was like, please help me. You know, I'm trapped in this little furry white shell.
When the Hendersons' grandson comes to play, Skeeter plays dead. Strangely, when Skeeter can be kept calm, that's when he seems able to stay alert. But nothing's more exciting for a dog than food. So to keep him awake long enough to eat, he has to be constantly petted and stroked. Otherwise, he's off in mid-bite.
I was just stunned that I had a narcoleptic dog in my hospital.
Skeeter's condition is so rare and so little is known about doggy narcolepsy that America's top vets are studying this home video of his symptoms.
It's not particularly unpleasant for the dog, except that he can't live a normal life. He just cannot be a dog.
He's being treated with antidepressants designed for humans. But so far, well, watch for yourself.
Right. So sleep apnea. This is when people's breathing stops briefly and frequently while asleep. And they tend to gasp for breath. They tend to have chronic and loud snoring. And this can lead to reduced attention and learning ability. Next, we have the sudden infant death syndrome. Also, we call it the SID. So, sleeping infants, they stop breathing and die. That's when we call it, they have this kind of syndrome. And usually it happens to 2 to 4 months old babies. And some are due to suffocation from sleeping face down. So not necessarily the syndrome. It's causing it. Okay. Yes?
When you have sleep apnea, that's when you have to like get a breathing machine.
For which case?
Sleep apnea.
It depends on how severe the symptoms is. So yeah, it really depends. Okay. Next we have nightmares. So those, yes?
I didn't think that nightmares count as a sleep disorder.
It's not. So those are bad dreams in your REM sleep, and it's not considered a disorder. So this happens more in children because they have more REM sleep than adults. So this is different from night terrors. Night terrors are people abrupt awakening with panic and intense emotional arousal. This occurs in deep sleep, so the N3 stage. This is not a dream, but the experience of emotion itself. So usually people don't remember having night terrors. And they can be very difficult to calm down afterwards, after they have night terrors. And this is rare for adults and more likely happen in children. Next, we have sleepwalking, also called this somnambulism. This is most common in childhood and boys. So the symptoms include sit up, walk, eat, etc. And this occurs in non-REM sleep. So the myth about somnambulism is you heard that don't wake up a person who's sleepwalking, right? So that's actually not true. That's not scientific. You should wake them up because it can be very dangerous for them. They could harm themselves or other people. I don't know if you heard of the case is this person killed his wife while sleepwalking. Have you heard about that case?
No.
It was pretty famous. And you can look that up. I think I embedded the link here in the notes. If you're interested, go watch it. Yeah, so we don't really know if he really killed his wife while sleepwalking, but we also don't have proof that saying that he killed his wife intentionally. So, yeah. So next we have REM behavior disorder. This is when our normal REM paralysis is absent. If you remember, when we have REM sleep, our body is paralyzed, so we don't act out our dreams. So in this case, the patient will act out their dreams. The body will react to anything that's in the dream. So this can occur in anyone, and it's most common in men over 60. This can occur in dogs as well. So make sure you distinguish the two. Both are when they do something while asleep, but this is not in the REM sleep. This is in the REM sleep. Okay, so next I'm going to show you a video about a dog.
Oh, I see.
Okay, so if I ask you to identify the symptoms or the disorder, I think it should be more likely to be REM behavior disorder than sleepwalking. But it's hard to know because we can't ask the dog, right? Okay. Any questions about sleep disorders? Yes?
So with sleepwalking, you said that's like in non-REM sleep. Is any stage in non-REM sleep more likely for it to happen? Like, would you most likely see it in like M1? Or?
So we don't know. I don't think I see any information about that in the literature that I see. So, yep. That's it? Okay. So let's do a practice question. Your roommate says that you seem to wake up dozens of times in the night, gasping for air, but seem unaware of it. You may be experiencing okay, very good. Sleep apnea. Next, Carlos wake his roommate up with a blood curdling scream of panic in the middle of the night. Carlos is extremely scared but doesn't remember anything. He suffers from night terrors. Okay. All right. Next, we are going to talk about dreaming. So why do we dream? We have the wish fulfillment theory by Freud. So he suggests that our dreams are wish fulfillment. That's why he suggests we can examine patients' dreams to learn about underlying or suppressed issues. Have you seen those movies or video clips? They asked patients, what did you dream about? And they try to interpret the dreams.
Yeah.
So that's based on Freud's theory, wish fulfillment theory. Next, we have the activation synthesis theory. This suggests that during sleeping, random signals are sent to the cortex. So the cortex tries to make sense of those signals. And that's why we dream. Next, we have the activation information mode model. This suggests what we do, experience, or think about during the day influences our dreams at night. And it suggests that your cortex uses recent memories to make sense of random signals. So next, I am going to talk about some other topics about sleep and dreaming. So lucid dreaming. This is when the dreamer is conscious and aware that a dream is a dream while it is taking place. They did a pilot study, so they tried to teach the person to lucid dream and they found out they have fewer nightmares. But the mechanism is unclear. So a pilot study means it's very preliminary. It's not well studied. Just some information for you. Astral projection. This is a willful out-of-body experience that assumes the person's consciousness is separate from the physical body. This is different from depersonalization disorder. So that disorder is the feeling of disconnected from one's body and thoughts. The person feels like being in a dream and observing oneself from a third-person view. According to so there's not a whole lot of scientific studies or experiments about this, but they suggest astral projection is not as dangerous, but depersonalization is very dangerous. It can cause anxiousness, they might feel loss of control, depressed, and people might feel like they're going crazy. You don't need to worry about depersonalization disorder because we will talk about psychopathology later in the semester. It's just some extra information for you where we talk about sleep and dreams. Next, we have hypnosis. So hypnosis is an altered state of consciousness in which the person becomes especially susceptible to suggestion. And this is not mind control or what you might see on a show. A lot of the typical shows that you see about hypnosis, those are just false ideas about hypnosis. Okay. And if you remember, we talked about this. It could be a myth. A lot of psychologists, a lot of therapists believe it works, but a lot of them don't believe it works. So it really depends. So applications of hypnosis includes altering sensory perceptions, such as smell, hearing, vision, time sense. Study also shows some hypnosis reduce anxiety and pain, nausea, and vomiting from chemo. So when people have cancers and they need to go through chemos, some therapies might suggest them to try the hypnosis. It might remove some bad habits for some people. So the myth is that hypnosis can change people's personality. That's not like valid or tested. It can erase memories. Nope, doesn't happen. Hypnosis can enhance memory or recover lost memories. Again, no, that's a myth. And regress people to childhood. So those are the myths and applications for hypnosis. So pretty brief. Any questions about hypnosis? Yes?
With that thing with like removing bad habits, isn't it only can't you only do some? Because hypnosis can only make you do things that you already want to do. Like, can't you only be hypnotized if you're wanting to be or if you're willing to be? So I read that in the textbook, but I'm not sure.
Yeah, I don't know. So for example, a lot of times you're trying like a diet, and then you find like 2 weeks later you actually lost some weight. It's not necessarily the diet could be the cause. It might be because you're doing the diets, you're more likely to exercise too because you're trying to lose weight. It could be the exercise. It could be something else. I don't know, become more active. So yeah, it's unless we actually have like an experiment, rule out all the other possibilities and only have that variables is controlled, then we can make that causal relationship. That's why, yeah, it works for some people anecdotally, but we don't know. Very good. Lastly, we are going to talk about drugs So, what is drug? Is heroin a drug? I'm asking.
Is it like a form of opium?
Okay.
Opium drug?
But would you categorize this as a drug? Yes?
Yeah.
Okay. What about cocaine? Yeah? Okay. Marijuana? Yeah? Alcohol? It's a drug. Tobacco? Yeah? What about coffee?
Some people do.
Yeah. Okay. Energy drinks? Anything that contains caffeine? Tea? Are those drugs? Yes?
I've heard them be like referred as like some type of drugs. Yeah.
Okay, very good. So drugs. The definition for drug is any substance that alters the body's function physically or psychologically when taken into the body, except food and water. So the stuff that we just talked about, those are all drugs based on definition. Drug can be legal or illegal. So legal drugs include alcohol, caffeine, tobacco, etc. Illegal drugs include weed for most states, most countries, ecstasy, cocaine, heroin, and etc. So drug dependence, there are two types. First, we have the physical dependence. This is when the body is unable to function normally without a drug. And tolerance means the body gradually needs larger dose for the drugs to work. When our tolerance gets built up after using certain drugs, including caffeine or coffee, it makes us very likely to overdose. That happens with any kind of drugs, heroin, cocaine, and when people overdose, your body functions might shut down, and so it's very dangerous. That's why drinking a lot of coffee is not good for you either, because you build up the tolerance. Next, we have psychological dependence. This is when the body doesn't need a drug, but you think that you need it. So it's like psychological. Not all drugs cause physical dependence, but any drug can lead to psychological dependence, including coffee. You heard that people are addicted to coffee, right? So those are more likely to be psychological dependence. All right. You good? Psychoactive drugs. Those are the substance that alters a person's thinking, perception, or memory. So this happens primarily in our central nervous system. So examples of psychoactive drugs include cocaine and crack cocaine, ecstasy, amanita, muscaria, mushrooms, marijuana, cannabis, and etc. So those are all psychoactive drugs. So types of drugs. First, we have depressants. Depressants, they reduce or depress our nervous system. So it increases our inhibitory neurotransmitters, such as GABA, and decreases excitatory neurotransmitters, such as glutamate. Some examples include alcohol, tranquilizers, and narcotics. Narcotics as opium, morphine, heroin, etc. Next, we have stimulants. They increase our nervous system activity, mostly in the central nervous system. They increase the levels of norepinephrine and dopamine. Therefore, stimulants also increase our heart rate and blood pressure. Some examples for stimulants include methamphetamine, nicotine, caffeine, and etc. It's kind of straightforward and kind of relates to your life, right? When you drink coffee, your body are more aroused. When you drink alcohol, your body is more relaxed. And the other drugs, you just learn about it, don't experience it. It's not good for you. Okay. Then we have hallucinogens. Those alters your perceptions of reality and may cause hallucination. Examples include LSD, PCP, ketamine, marijuana, and etc. Okay. The website that I showed you last time with the mouse, that's going to be very helpful for this kind of topic. You can play with it, so make sure you check that out if you haven't. That's it for today's class. If you don't have any questions regarding this chapter, I'm going to have this question and answer section right now to answer any questions about the exam. I will also monitor online students' response, so if you have any questions, fire them away. Yes, Luis.
I have a question. So like, slow waves is dependent on the size of the wave during I think REM state, right? Like, how would you describe like how the wave is? Because I was a little confused, like seeing the picture in the book compared to other ones. It seems more like unorganized, like it's everywhere, the waves.
Slow waves, I don't think it's the size, it should be the frequency.
Is the frequency?
Yeah.
Okay.
And also you don't need to get into like super details about like slow waves.
Yeah, it's just like the textbook just has like a picture of it, and that's the only time like it really like talks about slow waves.
Yeah.
So I'm like, is it the frequency? Is it like?
Yeah,
how
it should
big
be the
waves are?
frequency. Yep, and you don't need to know like which waves is for what kind of sleep. I'm not gonna ask you to identify like a picture, what kind of sleep is this. So no need to worry about that. Yes, Ethan?
What's the name of the first consciousness level, like at the tip of the iceberg is just considered conscious? When we have like unconscious, unconscious, and all those, it's just conscious?
Yep. Marcus?
Okay, like stuff that we learned today, if I can be on the test too, I don't know.
Of course, it's gonna be on this. Yeah. Yep. Well, the good thing is for today's topic, it's pretty easy, and you're gonna have very fresh memory when you take the test. So I wouldn't worry too much about today's lecture. That's called the recency effect. You have better memories about what you just learned. Yes?
Was descriptive research just split into like naturalistic observation, case studies, and surveys? Are those only three in descriptive research?
Can you say that louder?
Were the three types of, like the three methods of descriptive research, were they naturalistic observation, case studies, and surveys, or were there other ones included? Was it just those three?
I think that's it. Were there any others on the PowerPoint or no?
I'm not sure.
Okay, if it's not there, don't worry about it. And also, you don't need to come up with them as long as you can identify them. If I tell you, I'm doing this study, what kind of study is this?
Okay.
And then you can categorize them. That should be fine. Yep, I'm not going to ask you list all the descriptive studies.
Okay.
Yep, so as long as you can recognize them and know what they mean, you should be good. Did you have a question? No? Yes, what's your name?
Jacob.
Jacob?
Yeah, for the multiple choice question you posted, if you know pretty much every answer on those, like for each question, pretty well, would you, like, is there more we need to do, or should that be like the main focus?
No, so the practice question is to help you familiarize what the question is going to look like on the exam. It doesn't really cover anything. It's just an example of the questions. Because, you know, some people are not used to this kind of questions. You get a scenario, get a case, and then you try to analyze it. Yeah. I had a lot of students, when they finish the exam, they will argue with me, be like, this also applies to, like, I know this person applies to that. That's the reason I'm giving you the practice questions, is that to pick the best answers in social science, because we just can't find like a rule that applies to every single person. Like 1 + 1 = 2, that's like universal, but we don't have that in social science. Right? Oh, a tip is don't overthink on the exam. Don't overthink. Don't assume anything. Just use the information that I give you. Question? Hello? Hello?
You can force it.
Okay, I'll try to figure out who's. All right. Okay. You're answering questions?
Yeah, there's
Okay.
just like questions about like how do you zoom the work and stuff.
Okay. All right.
Like I'm gonna send out more information on that either tonight or back tomorrow morning. I'm gonna offer both HonorLock and Lockdown browsers, so you just click on whichever one you want to use. It'll be the same exam every time.
Can they take both?
I mean, if you want, but I'm only counting one.
Okay.
So
Well.
I'm just recommending one. I don't know why you would do that.
Well, so some people, if they can take both, they will try to get the higher score.
Well, whichever one comes through first.
All right. Yes.
So we're all doing the test online, we're not taking it in person?
Yes.
Okay.
Yep.
And it's during class time. So it'll close after that.
Mm-hmm.
So we don't have to like be in a Zoom for the test. We just take it during our own time.
Yep.
And I'm guessing that means there's no like lecture on Friday then.
No. No.
I'm just covering
Yeah. And if you want to take the exam here, you can come here to take it too. And we can talk about that later. It's some people, if they take the exam at the same environments where they learn it, they have better memories, and that's like scientifically proved. So you can come here if you want. Yes.
Okay, so you said we're not gonna have to be on a Zoom, but how are we supposed to set the webcam thing?
It's
It'll like automatically like walk you through the steps. I think I'm also gonna try to do like a practice run that I'll send out either tonight or tomorrow. That way, like if you don't have the system like on your computer already, like this is the first time using it, it'll like load everything on for you.
Okay.
Yeah, that's my plan. That's my plan. I'm hoping it works.
Yep. So yeah, the browser will guide you through that. Attendance, you don't need to do attendance on Friday. If you didn't submit the exam, it means you weren't there. You submitted it, you're there. Still have some time. I am going to send you a questionnaire after the first exam. You should get your grades pretty soon because it's automatic grade. If you have questions, you can ask me. So the questionnaire, it's like an early feedback. It asks your opinions about the class, about me as the instructor, anything that you don't like, anything that you like, you can put it there so I can make changes accordingly based on your response. else? Okay, so you get 1 extra credit for doing the questionnaire. It's anonymous, so you can be honest. You don't need to worry about me retaliating, because I wouldn't know who you are. Don't worry about that. And yeah, I figure when you finish your first exam, you will have a better idea how you're doing in the class and things that you like or don't like. You should have a better idea by then. What else? Another thing is I might go to China before the semester ends, so we might have classes on Zoom. I mentioned that at the beginning of the semester, right? I didn't say that I was going to China, but I said that we might transit to online classes later on in the semester. And I asked everyone to consider that. And yeah, so right now I'm going to talk to the people in school to see what I should do about that. Because the university actually prohibits me to transfer classes to online format, which is a little inhumane in my opinion, because I have family emergencies. That's why I needed to go home early. And I figure that if students have the options to go in person or online, I should be able to too, because I'm also a student. I'm a grad student. So yeah, I'm going to kind of talk to the people at school and we'll figure that out. Just a heads up for you guys. And definitely I'll try to still be interacting with you guys and be engaging, even though it's kind of hard for online classes, but I'll definitely try my best to do that. Okay, I can't think of any other important announcements. So if you don't have any questions, feel free to leave early if you want. If you do have questions, stick around and ask questions. Yes?
Do we need to know like the specific like effects of different teratogens? Like, do we know specifically what cocaine will have, like the effect of cocaine will have on a baby?
I don't think so. I don't think it's that specific. I can't remember having questions like that, but
like a type of question, like which one of these is not a teratogen, or
that will be you need to know that. You need to know that. But you don't need to know. I don't think you need to know. Okay, alcohol is gonna make the babies something, yeah, or
yeah. I mean, obviously, knowing fetal alcohol syndrome is probably going to use that as a given, but like there's some like cocaine making a baby like smaller and having learning problems later down the line, and there's just a lot of different things.
And also there are a lot of overlaps as well. So I don't think I have questions like that. It's going to be so confusing.
Okay.
Yep. Nikki, are you still here?
I just want to make sure like tracking was right and all that, and double check some of that.
Oh, okay. Biases. What kind of biases are you talking about? I can open the notes. Do you remember which chapters was it, or which lecture? Because I think we'll talk about heuristics later on in social psychology or in cognitive psychology. What kind of biases are you talking about, Nikki? Number 10 on the study guide for chapter 1 and 2. Yeah, you can unmute yourself, definitely. That's easier.
Okay, sounds good. So I guess I'll just read it out to you.
Okay.
It says describe and understand the relationships between different kinds of confounds. Experimenter biases, experimenter effects, observer bias, subject biases, demand characteristics, response biases, single versus double, which I know, random assignment. So all those like different biases. Does that make
Okay.
sense?
So you want me to go over them?
Yes, please.
Yep, of course. I'm going to find the lecture slides and then I will go over them with you. Do you remember which lecture was it?
I don't. It just says chapters 1 and 2. But it mostly looks like it's gonna be chapter 2 since it has to do with a lot of like oh my goodness, what is it called? Like gaining different how to gain. Oh my goodness. How to gain not knowledge but like information off
Okay.
of like surveys and stuff like that. I think that's chapter 2.
Okay, let me see if I can find them real quick. I'm going through the slides. Okay. Oh, wait. So, do you have trouble with self-awareness and demand characteristics?
It's not on the study guide, but I
Okay.
understand what they are.
Okay, cool. So observer bias is, as the observer, I'm the experimenter, so I'm the observer, right? And when I make an observation, I tend to focus on the things that align with my original thoughts. So let's say, in my mind, I had this idea that all women has longer hair than men, so I'll pay attention to all the long hair women and the short hair men. I might pay less attention to a woman who has short hair. I might just assume, okay, that's a man. That's observer bias. Does that make sense?
Yes, so you would likely side with your hypothesis.
Yes. So as the experimenter, we have biases. And the double blind is when you don't know the hypothesis. You're just observing. You don't even know what you're looking for. So that's a solution for observer bias.
Okay.
Yep. And then double blind means the observer is blind and the participant is blind. So the participants, they don't know you're observing, so they behave naturally. They're not like, so you know when people know that they're being observed, they might behave differently. So that's the double blind study design. Do you guys have questions?
I should ask you a question after. I don't know, is she done asking a question?
I think Nikki's question is going to be pretty long. I need to go over the biases, but
Okay, so
do you have any?
he's taking an exam in the class before this one, and he wants to take it at home. I didn't know if you would be willing to let him take it during a different time other than the class period?
Wait, so you want to take it earlier or later?
Well, my question, I could take it earlier if you want me to.
So the problem is,
Yeah, it's just it's in person, my first test at noon.
Okay, gotcha.
Yeah.
You could take it
I
earlier, but
can see if IT knows if there's a way to like open up something specifically on his eCampus.
oh no, you can do that.
You can?
The,
Okay.
It's just school policy
Yeah,
that if you
yeah.
take it early, we need to make sure that you don't leak the questions to other people, or if you take it late, other people won't tell you about the questions. Right now, I can't think of anything because if it's in person, usually I just like be there, and then when they take the exams, I'm there, so I know they're not writing down questions.
Yeah.
They can't just tell other people, right?
Okay.
Um,
Well, it's not really.
in terms
if
of
not,
this-
it's fine. I'll just take it here. It's really not
Okay.
hard.
Or if you can think of any.
Yeah, I mean,
Okay.
I don't know any other way to do it.
Yeah.
Well, I still do it on the laptop, right?
Yeah,
Yeah.
I mean, it's gonna be proctoring him either way.
Yeah.
It's just that's your preference. That's why I wanted to ask before. I was like, oh yeah, sure. You know what I'm saying? Like.
Yeah. So if you can think of any suggestions, I'm open to that.
Okay.
Yep.
I'll email you then.
Okay.
Cool. Sounds good.
All right. Awesome. Sounds good.
Thank you all.
Yeah, you're welcome.
Question? No?
I just want to hear what other people
Okay. Cool. So you said observer bias and double blind, Nikki, and what else?
Let's see. Subject biases, and like response biases.
Okay, subject bias and response bias, those are for the participants. So when you go in, have you done the research study here?
No, I have not. I haven't done one.
Okay, so Ethan, you did it, right?
Yeah.
So when you go in, they will tell you what the study is about, right?
Yeah, but not specific.
Not specific. So you kind of want to know what's going on in like human. We are curious in nature. We kind of want to know, okay, what's going on? They're trying to test. They're asking me this type of questions. Are they trying to test my personality? Or are they trying to get what kind of information out of me? So that's subject bias. You will answer questions that kind of works better for you. It might make you feel better, look better in the eyes of the researchers. You don't want to look stupid during the test, right? So you try to work harder. So those are subject bias. What's the other one? The other term that you talked about?
Yes, it was. I'm so sorry. This was such a long question. Response biases.
Response bias. So response bias is kind of like social desirability. So when you respond to certain questions, you will consider whether this is acceptable in the society, right? If I ask you, have you done cocaine before? Usually you will say no, right? But if you're being honest, you would need to say yes. So that's why we need to make sure the questionnaire is stating this is anonymous. Please be honest. We're not going to leak your information. We're not going to judge you, so that we can get rid of that bias, response bias. Does that make sense?
Yes. So as far as response bias versus, sorry, that's my dog. As far as subject bias, it sounds like response bias based off of like everybody else, like how society would view you. And then it sounds like subject bias is kind of how the researcher would view you. Is that correct?
No. Well, okay. So, yeah, you don't really need to differentiate the two. So there's overlap between the two. One might be more targeting you being the participant. The other one might targeting you being a member of the society. But in either case, they can overlap. So for example, you're being the participant. You also don't want to look dumb. That's like a society norms. So it can be both. So you don't need to differentiate the two. You just need to know what they mean.
Okay, sounds good. Sounds great. Thank you so much for that thorough explanation. I know it was a big question. I'm sorry.
No problem. That's a good question. All right.
All right, thanks.
No problem. I think we're good. Unless you have more questions. We're done. Okay.
I think you should go online. Take care of your family.
I want
I
to.
agree with you on that.
I really want to. I don't know if I can, but I'm gonna talk to the people and then see what I can do.
Well, if there's something a student can write.
Yeah, maybe I can get you guys to sign something for me.
Yeah.
Yeah, but thank you. I'll keep you guys updated.
All right.
All right. Good luck with the exam on Friday.
Thank you very much.
Thank you.
You good?